Hello, good morning, good afternoon, or potentially good evening, depending on where you're joining us. Thanks for spending part of your day with us here to talk about LSVT Loud and LSVT Big and how they can improve function and quality of life in advanced Parkinson's disease. My name is Beth Peterson. I'm a speech language pathologist and one of the LSVT Loud faculty instructors. I'm joined by my colleague Laura Gousset, who is a physical therapist, and she's one of the LSVT Big faculty instructors and the chief clinical officer with LSVT Big. In the slides and the handout that you'll receive or may have already received, there's more details in our biographies for you to reference. So we won't go into detail here in the interest of time, but just letting you know that it's in your handout. And in terms of disclosures, as faculty members, we have both financial and non-financial relationships with LSVT Global. The non-financial relationships include a preference for LSVT Big and LSVT Loud as treatment techniques. And the financial relationships include that Laura and myself are both employees of LSVT Global and receive lecture honorarium. I'd like to just briefly go over the plan for the webinar so that you know what to expect today. So first I'll just cover some logistics. So if you're joining us, you should have a webinar control panel. Sometimes, just depending on how your webinar opened up, you may see the full control panel with many options, including a chat box, a handout box, or you may just see an orange arrow with a smaller menu. So if you have that smaller menu, you can click on that orange arrow so it will expand your whole webinar control panel, and then you'll see more options to be able to view things and participate in the webinar. So you should have received a handout. I think it was just emailed within the last hour or two to everyone registered for the webinar, and that include a handout of the presentation today so that you have the slides for your reference. We'll also include that in the follow-up email, and then in your webinar control panel, you should see a handouts tab, and so you can click on the handout there as well so that you can access the notes today. So what we'll do, we'll start with a presentation of content, both myself and Laura, and then we'll have some time at the end to address your questions. And at the very end, a survey will pop up once you exit the webinar, and it should take 5 or less minutes just to give us some feedback on if you felt like you learned what you should during the webinar and just how it went in general. And if you have any feedback or comments for future webinars, we'd love to hear that input. And also just to mention, right now, everyone in the audience, your microphone is automatically muted. That's just to make sure that we don't have background noise from the various environments where you may be joining us. But if you do have a question, you can always type in your question in the question box on your webinar control panel, or you can raise your hand and we'll see that you have a question, and then I'll call out your first and last name to let you know that I'm unmuting your microphone and you can ask your question out loud to the group that way. And we'll also have some time again at the very end for questions. So we can address any of those questions that come through chat at the end of the presentation here today. For self-reporting continuing education activity, this webinar is not ASHA or state registered for CEUs, but it may be used for self-reported CEU credit for physical, occupational, and speech pathologists. So if you'd like a certificate from the webinar so that you can use it to self-report your activity, once the webinar ends, you can just email webinars@lsvtglobal.com to request a certificate, and then we'll send one via email. It takes up to 2 weeks, but it's usually sent within just a few days. Again, you'll also receive a follow-up email directly after the webinar with a reminder to do that so that you can get your certificate if you'd like it. Attendance for the full hour is required to earn a certificate. And I'd like to just go over the objectives of the presentation here today so you can see what we hope to accomplish. By the end of the webinar, we hope that participants are able to define advanced Parkinson's disease, identify common changes and challenges associated with advanced Parkinson's disease, summarize how the structure and methods of LSVT Loud and LSVT Big are used when treating those with advanced Parkinson's disease, and then also reflect on how caregiver education and support and technology can help individuals with advanced Parkinson's disease achieve and maintain their highest level of function. So those will be our overall goals and objectives to cover here with you today. Before we jump into the content, we do want to know who's joining us. So I'm going to pull up a poll on your screen. And the poll, we just want to know, are you a person with Parkinson's disease, a family member, a friend or care partner, a PT or OT or assistant, speech language pathologist or assistant, or another category? So let me see, it should pop up on your screen now. So I'll give you all a few moments if you can select your category there. All right, so we see the results coming in. So we have a good mix of those with Parkinson's and family members, and then also PTs, OTs, and speech language pathologists. All right, so I'll go ahead and close that. That gives us a good idea of who is in our audience today, so thank you. Okay, so we're going to start with a definition of advanced Parkinson's disease, or what is considered advanced. So on this slide, you see the modified Hone and Yahr scale. And for those who aren't familiar with it, it's often used by neurologists, movement disorder specialists to help classify the severity of Parkinson's disease. So it ranges from really 1 to stage 5. And today, what we're talking about with advanced Parkinson's disease, we're looking at stages 4 and 5. So getting into severe disability, potentially still able to walk or stand unassisted, or when we move into stage 5, wheelchair bound or potentially bedridden unless aided. And some additional kind of characteristics with advanced Parkinson's, we're seeing the onset of motor complications despite more aggressive pharmacological or medical and behavioral managements. So some of the motor complications we're seeing are wearing off of the drugs, or more on-off fluctuations, so more off times where the medications aren't active and working right now. Dyskinesia, so those involuntary muscle movements that can occur as a side effect related to some of the dopaminergic drugs. Also potentially drug failure response, so they're just not really kicking in and working anymore. From some of the cognitive issues that may be more prominent, hallucinations, dementia, memory. So these are all some of the characteristics that literature is showing us and that we're seeing in our patients with advanced Parkinson's. So when we look at some of the medical treatment options with advanced Parkinson's disease, we have the option of deep brain stimulation for some patients. And this may be used when the dyskinesias are severe due to those high doses of dopaminergic medications. With this, patients would have a careful cognitive screening with their DBS team to see if they would be a good candidate for DBS. And falls, freezing of gait, balance, voice, and speech may not be improved, and potentially even worse post-DBS. So those are just some considerations and some discussions that individuals should have, again, with their neurosurgery team. Pharmacologically, what we're seeing is potentially less effect overall from the medications. Again, maybe more increased off times when the medication is not working, so still getting more of those motor symptoms, more side effects from the medications, and more or different types of pharmacological therapy may need to be added on. I'm going to briefly touch on the research that's been done with LSVT LOUD and LSVT BIG, and then see where advanced Parkinson's disease research fits into that. If you aren't familiar yet with LSVT LOUD and LSVT BIG, they're both based on evidence that's been conducted for over 30 years now, beginning in 1987, with the initial invention of LSVT LOUD, or the Lee Silverman voice treatment, all the way up to where we are today, where now we are training therapists, both speech, physical, and occupational therapists all around the world to deliver both LSVT LOUD and LSVT BIG. And within this journey, you can see some RCT highlights here, which are randomized controlled trials, or the gold standard of research. So we have 3 for LSVT LOUD and 1 for LSVT BIG. And that's when the treatment was compared to a control group and then also another comparison treatment. And we see some great outcomes with LSVT LOUD and LSVT BIG compared to the control group and the alternative treatment delivery method, to really show us that we have this great research backing the treatment, and this is a go-to treatment approach, both LSVT LOUD and LSVT BIG for anyone diagnosed with Parkinson's, all along that staging from beginning with stage 1 to stage 5. Now, we don't have as much research specifically on advanced Parkinson's disease, so getting into that stage 4 and 5. What the literature shows us are more case studies or just looking at subjects with advanced Parkinson's disease within the greater kind of subject group. So we highlighted a couple here on this slide. With LSVT BIG, there was a case study looking at someone on that was classified as Hone and Yar stage 4, and this participant showed improvements in motor symptoms, and all the motor improvements exceeded the minimum clinically important difference or minimal detectable change values. So seeing some nice improvements in that individual. Again, just a case study compared to a whole group, but gives us some promising research that it can certainly be applied well to those more advanced. And then with LSVT LOUD, with the citation you see here is from the most recent randomized controlled trial conducted by Ramig and colleagues in 2018. And with that, they saw that there were no significant associations between time post-diagnosis, so ranging from 0 to 31 years post-diagnosis, within group treatment changes. So it's showing us that regardless of disease severity, the participant showed similar treatment-related improvements within the group. So for both of these, we're seeing some great potential to show us that LSVT LOUD and LSVT BIG can be applied to those with more advanced Parkinson's disease and can have some great outcomes. So even though the research specifically with advanced Parkinson's disease is limited, here's what we do know. We know that people with advanced Parkinson's disease can still learn new things and improve their quality of voice and movement. These improvements may be smaller in magnitude as compared to those stages 1 through 3 on the Hone and Yar scale. It may take longer or more sessions to make those improvements, and Laura's going to talk more about the specific protocols, but they're 4 days a week for 4 weeks, and sometimes with our individuals who are more advanced, we may add on a week of treatment. We also will follow up more often for these individuals, so whereas those earlier in the course of the disease, we may just follow up every 6 months or so. With those who are more advanced, we are following up more often, so every 2 to 3 months. Also, those with advanced Parkinson's disease may need therapy more often to help maintain the gains and slow that symptom progression. So again, probably closer to 2 or 3 month check-ins, and then potential additional therapy sessions at those time points as well. But it is important to note that despite requiring more sessions of therapy and more frequent follow-up to make those improvements and maintain function, there's still great value to not only the individual being treated, but also their caregivers, their family members, and really to society as a whole. So we're helping to prevent the need for moving on to the next level of care and helping to handle medical complications that are related to that advancing disease with declining function. So we're seeing that we can still make a very functional impact, again, not just for the individual with Parkinson's, but also their loved ones and society in general. So I'm going to briefly touch on some of the speech and physical characteristics that we're seeing with advanced Parkinson's disease, and I'll start with the speech characteristics. So in addition to the more common changes in voice and speech, such as low volume, hoarse and breathy voice quality, we're starting to see potentially more imprecise articulation, vocal tremor or disfluent speech, which may sound a bit like a stuttering type speech, initiation difficulties or inappropriate silences. We might see some hyperfluent speech. So this might sound like more compulsive or effortless repetition of words and phrases, or word and phrase repetitions tending to occur at the end of an utterance. So in general, calling this hyperfluent speech. And then also seeing a need for increased time for processing information and responding. Some of the motor characteristics that we're seeing with advanced Parkinson's are an increased severity of bradykinesia, or that slowness of movement, hypokinesia, the smallness of movement, and then rigidity and freezing. More difficulty walking, so individuals may be using a wheelchair more often, or maybe staying in a bed or a chair more often. Often, I would say most cases not able to live alone, help needed with most activities of daily living, increased falls or fall risk, greater need for assistive devices, and worsening of posture. And some of the non-motor characteristics that we're seeing in some patients, so psychosis and hallucinations, depression, anxiety, and apathy, some sleep disorders, autonomic dysfunction, pain, dementia, and other increased neuropsychological changes such as slow processing, attention, difficulty shifting set. So some of those non-motor characteristics may be present as well. There's also some other challenges that may occur with advanced Parkinson's disease, so worsening of comorbidities or other types of medical issues going on as well, a new and higher number of comorbidities, unpredictable on and off times, again related to the medication. So when will they be working and when will they be off or not being active, or worsening or longer off times, so more periods of time where the medication is not helping with the symptoms. May have more difficulty with motor planning, decreased motivation or understanding of their surroundings or situation. And you can see how this could also lead to some care partner stress, with the care partner needing to assist with many of the daily activities, and potentially less understanding of advancing symptoms by healthcare professionals. Some of the secondary impairments that may be seen are deconditioning or loss of muscular strength. When we're not using our muscles as we did previously, these are some of the things that we can see. Fixed postural changes, pain, loss of normal range of motion or impaired balance, aspiration, which can be caused by swallowing difficulties. So this would be when food or liquid goes toward the airway and filters into the lungs. So these are all kind of secondary impairments that can be related to advanced Parkinson's disease that we want to be watching out for. And then when we're under the care of speech, physical, or occupational therapists, that they're also aware of these and can help with these as well. So you can see that these motor and non-motor complications can dramatically impair the quality of life for the patient, care partner, and their loved ones. But that all is to say there is still great hope. So we say don't underestimate the value of therapy just because the condition is in an advanced stage. So we have seen clinically, again, you've seen some of it in the research also, that people with advanced Parkinson's disease can still have amazing outcomes. We can still make huge functional improvements with communication and movement of any kind that can really dramatically improve quality of life. So it's really great to know that despite some of the challenges that you've seen on the previous slides, or maybe that you're experiencing yourself, there's still so much that you can do to improve that functional communication and movement. So Laura's going to start talking about how LSVT LOUD and LSVT BIG can be used to help people with advanced Parkinson's disease to, again, really help with that quality of life, improve function for both communication and movement. So Laura, I'll go ahead and turn it over to you.
All right, thanks, Beth, and thank you everyone for joining us today for this very important topic. As Beth mentioned, there are a myriad of symptoms, and the complexity of advanced PD is something that you saw in these last slides and probably know well yourselves too. And because of this, it really deserves a multidisciplinary patient-centered approach. You're probably familiar with speech, physical, and occupational therapy, and I think it's good to always review what these professions do, because there is definitely a little bit of crossover between the professions, but we all work together seamlessly, especially when we use protocols like LSVT LOUD speech therapy or LSVT BIG physical or occupational therapy. In general, speech therapy works on swallowing and cognition, as well as speech and voice therapy. In this instance, LSVT LOUD physical therapy usually focuses on mobility, balance, gait, fall prevention, exercises to improve strength, condition, range of motion, and a lot of that is encompassed within the LSVT BIG protocol. And for occupational therapy, they really work on what are called daily living tasks or activities of daily living that could be doing with self-care, dressing, bathing, grooming, toileting, moving around in your home. Could be occupational related tasks related to different roles you have, not just your job, but at home, maybe you're a parent or a grandparent. They work a lot of mobility, safety, cognition, and much of what they do is also encompassed within the LSVT BIG protocol. So let's take a little bit closer look to see exactly what LSVT is. Now, many of you are already quite familiar with LSVT and might have already received this treatment yourselves, or if you're a clinician, you might be certified in LSVT. But for those that aren't familiar, one of the top questions we always get is, what does it stand for? And it stands for Lee Silverman Voice Treatment. It was named in honor of a woman named Lee Silverman that lived many years ago, who really inspired the development of what we now call LSVT LOUD. So it was named in her honor. Now we have two treatments, LSVT LOUD speech therapy, which came first, and then LSVT BIG physical and occupational therapy, which was developed based on the principles of LSVT LOUD. Both are standardized protocols and both have a prescribed dosage and method of delivery that's based upon 30 years of scientific research that Beth showed you the highlights in that slide earlier. LSVT is delivered only by certified speech, physical, and/or occupational therapists in these treatment protocols. So if we move on to the next slide, let's talk a little bit about what is so unique about LSVT BIG and LSVT LOUD. You know that there are many different types of therapy interventions that are used to treat Parkinson's, and you might have received therapy in the past. So these are the key differentiators. First, we know that Parkinson's disease tends to make movement slower and smaller and the voice softer. And the LSVT protocols really counteract that by training bigger, more normal movements and a louder, healthier voice. And there are other improvements that come along with that, but that's our main target. The other thing that goes with these protocols is it not only targets the motor symptoms, but also the non-motor symptoms common to Parkinson's disease. And Beth mentioned that there can often be changes in cognition. Learning things takes a longer period of time. There's sensory deficits. We'll talk about those in a few slides, but those can impact a person's ability to learn and to generalize these improvements into everyday life. And so the LSVT protocols do a really great job of considering those and treating the patient intensively enough and in a manner and a very special method to help them breach those barriers. The third of these things is that the treatment is individualized. There are many very wonderful group exercise classes in the community that can be had for people with Parkinson's, like boxing and dancing and Tai Chi and yoga, and there's just a ton of them now, which is wonderful. And many of those do have good research supporting their benefits for people with Parkinson's disease. But the LSVT protocols are different. These are one-on-one intensive therapy treatments, so they're only delivered by therapists that really work on functional things that are personalized to each patient. And we'll also be talking about those in later slides. The fourth of these is the scientific research. And if you look as a whole in the body of literature of physical and occupational therapy and speech therapy, there is quite a bit of research altogether on the use of exercise for Parkinson's disease and different therapy interventions that have been utilized. However, the LSVT protocols are very special because of the length and great depth of research over the last 30 plus years. In fact, LSVT LOUD is the only speech treatment with level 1 evidence. That's the highest level of evidence you can have for treatment for voice disorders in people with Parkinson's disease. LSVT BIG itself has several randomized controls and a growing body of literature of other studies as well. So what that means for you, if you're a person with Parkinson's or a family member or a clinician, is that it gives you confidence that these treatment interventions do work. So let's move on to the next slide. Even though these treatments are standardized in their dosage and frequency, they're very, very much individualized. We know that there are no two patients that are alike. Even if they have the same diagnosis, they're the same age, same gender, they're all very different, not only in their stage of Parkinson's disease, but just who they are as a person, the goals that are meaningful to them, their roles in life, the things that they love to do, the comorbidities that they might have. And because of this, it really deserves an individualized treatment approach. And so in these next slides that I'll be showing you, you'll learn just a little bit about how the treatment protocols can be adapted or progressed to meet each person's need across a range of disease severity and presenting impairments. So the protocols are flexible enough to be really challenging for people with subtle deficits, such as those with early Parkinson's disease, but we can adapt them and make them feasible and safe and still valuable and helpful for people with advanced Parkinson's disease or more complexities. So let's look a little bit about some of the key features of the LSVT protocols. The first is the target. As I mentioned, there's a single target of amplitude. We're really focusing all our attention as therapists on driving loudness or driving bigness, not to the point where we're teaching patients to shout or we're teaching them to move in a crazy big way. We're really driving their effort to rescale them back up to a normal, healthy vocal loudness with LSVT loud and a normal, healthy bigness with LSVT big. And what you'll see in these slides, if you look a little bit deeper at the pictures, is that it's just not the amplitude that improves or the loudness of the voice that improves, but there's a great spread of effects. When you say something louder, it triggers your brain and you automatically open your mouth more, you take a deeper breath, you use more of your facial muscles. And so there's this great spread of effects that has also been studied over the years to show that, you know, there are other things that improve, such as articulation, respiration, there's been neural changes even found. For LSVT big, even though we're simply working on moving bigger, through that, other things improve as well, such as speed of movement. You see him swinging his arm more, taking longer steps, posture is improved, and also, like LSVT loud, that spread of effects has been studied over the years and continues to be as well. The second of the key principles of the LSVT protocols is the mode is intensive and high effort. Even for people with advanced Parkinson's disease, who you might at first say, oh, they're frail, they really can't take, you know, treatment that's too intensive, too high effort. And we say, yes, there is a minimum dosage for efficacy that we've seen through the literature on LSVT loud and on LSVT big over the years. And that dosage is 4 consecutive days a week for 4 weeks in a row. So the patient is provided with a minimum of 16 sessions of therapy. And that really, really helps with motor learning through that repetition of practice. The sessions are 60-minute long sessions. There's a lot that we do in that session, working on both exercises that are, you know, either vocal for LSVT loud or movement for LSVT big. And there's also a tremendous amount of functional practice related to communication skills, activities of daily living, mobility, and such. I mentioned that it's individualized treatment, not group treatment. The therapist is entirely focused on the patient and that patient alone. So it's a very active treatment where the therapist is engaged, doing the exercises with the patient and working on functional tasks that are very, very specific to that patient. In addition, the patient has daily homework practice and daily carryover exercises all 30 days of the month to really help that patient get into a lifelong habit of practice so that they don't just improve during that 1 month of treatment, but they've become accustomed to practicing using their louder voice and bigger movements every day, which helps to maintain those gains over time when they practice every day. And like I said before, it's always delivered by LSVT BIG certified physical and occupational therapists or LSVT LOUD certified speech therapists. So be sure if you are a person with Parkinson's that you make sure that the person that is offering LSVT to you is certified. So let's move on to the next slide and talk about the third goal, which is calibration. There are barriers to generalization. And what I mean by that is that so oftentimes what happens to us as therapists is that we work hard with our patients in the treatment room and we get them talking louder or we get them moving bigger, only to, unfortunately see that as soon as they walk out of the treatment room, they revert back to using their softer voice or smaller movements again. And it can become frustrating for the patient and also a little defeating for the therapist as well to wonder, why isn't sticking? Why isn't it carrying over to their practice when I, said to them, well, that's how you should always talk, or that's how you should always move. But we know Parkinson's is complex and there are these non-motor disorders. The first is a sensory disorder. And because of the sensory disorder, oftentimes people with Parkinson's disease do not realize the degree to which their movements have become smaller, that their posture has changed, or that their voice is softer. And if a person can't detect an error in their movement or the voice, there's no way that they can correct the error. So that's one thing that we really tackle, is to make a person aware so they can begin to feel what a louder, more normal voice feels like and what a bigger, more normal movements feel like. The second of these issues is an internal cueing problem. If you have Parkinson's disease, or if you live with someone with Parkinson's disease, you probably understand that, hey, if they want to, they can shout, they can talk louder. And if they want to, if there's a fire, they might be the first one to get out of the house. But there's something within that brain that doesn't trigger that. So there's kind of a deficit of being able to cue oneself. That's common in Parkinson's disease. The third of these is neuropsychological issues, and there's a myriad of them. They can relate to slow thinking. It takes longer to process things, takes longer to learn things. Attention and focused attention can become difficult. What we call procedural memory, remembering how to do things, even simple things like get on a coat, can become more difficult. It's not impossible. It just means that the person with Parkinson's that has these neuropsychological problems needs more repetition of practice. They need a therapist that keeps their cueing really simple, really redundant. In the case of LSVT BIG, it's a simple cue of either think big or think loud, where whatever they're doing. So sensory recalibration is the process then of teaching our patients to self-monitor and accept that what feels too big or too loud to them is actually within normal limits. And further, why is intensive treatment and calibration needed? It really takes effort, practice, and repetition to relearn how to talk with more normal volume and move with more normal movements. Bradykinesia, as you know, is slow movement and makes everything smaller. Hypokinesia is small movement, and it really takes a lot more effort to move and speak than it does for a person with Parkinson's. Some of my patients have even said, it feels like I'm walking through the mud, or it feels like I'm walking with cement blocks on my feet. And so as therapists, we really try to drive that effort to teach them how to rescale up to normal amplitude. There are also a number of sensory hallmarks of Parkinson's disease. There's a mismatch between what the person with Parkinson's perceives and what actually comes out. So they may feel like their voice is adequately loud or their movements are, normal in size, but in fact, it's smaller than normal and it is too quiet as well. And usually when we show someone on video camera how they're moving or play back their voice, they're a little alarmed at first to say, wow, I really didn't understand that my voice was so soft. I thought my spouse needed a hearing aid. And so that's really step one, is making people aware and then retraining them what it feels like to move and talk more normally. So our goal with LSVT Loud is not to just do treatment exercises, although those are an integral part of the treatment session. And you'll see on this next slide her saying this long ah, and then they do highs and lows where they really work on a repetition of practice, training normal vocal loudness that's healthy in nature. But they don't just stop at exercises. The second part of the treatment then is using that louder, healthier voice in conversation. So that therapist might say, okay, did you feel that effort you used in that long ah? Now we're going to make a phone call, or we're going to practice reading this passage, and you're going to use that same effort as you're talking on the phone to your son, or as you're reading this passage. And so the therapist is continually giving them feedback about how loud is loud enough. The practice is really personalized for each individual, and you'll see a number of examples here on this picture. It might be being able to be heard at mealtime when there's, a restaurant, many people talking, and, you want to engage in the conversation. It might be working on communication of basic needs with a caregiver, being able to talk on the phone and being heard by family or loved ones or people that you're trying to communicate with. It might be telehealth, being able to communicate loudly enough so that your caretaker, your physician or therapist who's giving you treatment can actually hear you. So the tasks that are chosen regarding communication are very much chosen purposefully and intentionally to meet the needs and goals of every patient. Likewise, with LSVT Big, we do spend about half of the session working on large amplitude exercises, and you'll see a picture of her doing a step forward and reach exercise here. So we work on bigger movements in all directions, forwards, backwards, sideways, rotation. We work on posture. We even work on, a bigger posture of the hand with the fingers spread open. And we work on those intensively so that the person knows that they can move bigger. But then the second half of the session is really training a person how to use that same effort in functional tasks. So if this were my patient on the right, I might say, okay, we just did that step forward and reach exercise. You practiced taking those big steps and you did so well. Now I want you to remember how that felt and use that same effort, that same bigness as we're practicing walking with your walker. And so in that way, the patient is really trained not just how to be good at exercises, but how to integrate into function. And here's some examples on the next slide about things that are commonly worked on through LSVT Big, but the list is virtually unlimited. It could be related to dressing, such as buttoning your own buttons in a much faster, more efficient way, putting one's socks and shoes on more efficiently and independently. Could be simple things like brushing one's teeth, standing up in big posture, being able to do that with bigger movements more effectively, getting in and out of a car, getting in and out of the lazy boy. For people that don't walk, it could be using a bigger stroke on the wheel when self-propelling their wheelchair, or using bigger foot motions when propelling a wheelchair. So again, the therapist really digs in and tries to identify what are the things that you're struggling with. How can I improve your quality of life? What are the key things that we should work on that would help you to enjoy your life more, be independent more than you are now, require less assistance from your caregiver? And LSVT Loud and LSVT Big, it's really a lifelong model of care. We recognize that Parkinson's is a chronic condition. We hope for someday a cure, but for right now, our goal is to meet the patient wherever they're at, whether we meet them in early Parkinson's disease soon after diagnosis or many years down the road, and continue to assist them and support them through LSVT Loud and LSVT Big. So the first thing that we do if a patient is appropriate for these protocols is deliver the dosage, this intensive 1-month dosage of either LSVT Loud or LSVT Big. Sometimes that's in the same month that they're doing, 1 hour of LSVT Loud and 1 hour of LSVT Big a day for the month. Sometimes they're spread out. So LSVT Loud is 1 month and LSVT Big is another month. So that really is an individualized decision, but it's much like going to the dentist when you maybe haven't been there in a while and saying, hey, let's get you as healthy as possible. Let's optimize your movement and your voice. And that really takes that intensive 1 month of treatment to make those big gains. The patient also does daily self-practice, and it really doesn't take a lot of time. It usually takes about 15 to 20 minutes a day during the month of treatment, and also lifelong after this month of treatment is over as well. In addition, we have programs called Loud for Life and Big for Life, and these are community-based exercise classes specifically for people that have received the full LSVT Loud and LSVT Big protocols. These are newer programs, but there's a number of programs around the country, so there might be one in your community that you can find. There are also some virtual classes as well that people can join. And then lastly, we really follow a dental model of care where we don't just say, hey, see you, call us if you have any issues, if you have a cavity or something. We really say, okay, you did great with LSVT Loud or LSVT Big, and I want to see you back in 6 months and see how you're doing. And that really helps people to not only stay accountable, but stay motivated. We're nipping things in the bud if we see any changes in voice or in movement, and we can really help people to maintain their gains long-term over time and hopefully slow that symptom progression. So let's talk about some special considerations for people with advanced Parkinson's disease through the LSVT protocols. The first is this: the exercises may need to be adapted. The standard LSVT Big exercise protocol is 2 exercises in sitting and the rest are done in standing. However, we can adapt those to really any position. We can give a chair for support as shown in the top left-hand picture. We can give even 2 chairs for support so they're hanging on both sides. We can adapt all of the exercises or some of them to a seated position, and we can also adapt some or all the exercises to a lying down or supine position that's shown in the bottom picture. And these adaptations are done to help people feel confident so that they're not fearful of falling. And the last thing we want someone to do is to be hesitant in their movement because they're afraid of falling, or of course actually fall. We'd never want that to happen. We want people to feel successful, that I can move bigger and I feel safe when I do so. And we want to be able to positively reinforce that, yes, I can move bigger, and I know that I can also move bigger and function as well. So there's some other adaptations that we can provide for both LSVT Loud and LSVT Big. As you see here, we can provide more hands-on physical assistance with LSVT Big, and that's common in advanced Parkinson's disease, that the therapist might be guarding, they might be using their hands to really facilitate a better quality movement. We can have, increased repetitions, but for shorter durations. We can certainly give rest breaks. And with that prior point too, sometimes we actually reduce the repetitions to start with, but we never eliminate exercises because each one of those has a very great purpose. For LSVT Loud, they can slow the pace down a little bit in that they're persisting at what's called the phrase or sentence level of the hierarchy for LSVT Loud. They can alter materials for visual or language impairments as well. So for LSVT Loud, they use a lot of very personalized reading materials that are on topics that are interesting to the patient. And for people that can't see it or can't read it, there's a number of ways that they can adapt for that. We certainly often utilize family and support systems for carryover. And if the patient has cognitive issues, we try to identify who those potential support people could be sooner rather than later. And lastly, we don't reduce the dosage, but oftentimes people with advanced PD actually need additional sessions and more frequent tune-ups to achieve their most optimal gains. So what if there are changes in memory or cognition? There are many things that we can do and that really do help to promote motor learning and retention in people with cognitive issues related to advanced Parkinson's disease. So the first thing, the therapist has to do an assessment, and this is not ever an assessment of intelligence. It's really just things like memory and problem solving, and the more they know about that, the more that they can make a plan early on how to facilitate learning that will be successful. The therapist might employ a treatment room that is quiet versus being out in a busy therapy gym so that the patient can really focus on what the therapist is saying and what they're teaching. We elicit support from care partners who can cue and coach. And again, we do that early on. The way that we teach is very simple. So we don't give a lot of complex instructions. We really model the movements or model how we want them to use their louder voice or do their long ahs or their LSVT loud exercises. And this way of teaching makes it very simple to learn. Repetition is key. You see repetition, repetition, repetition. This is true for all of us when we're learning new skills, but for people with Parkinson's disease and cognitive changes, this is more important than ever. We keep the focus simple. It's really one cue, think big or think loud. So when we're working on, bed mobility or transfers or, getting dressed or toileting, really we're just saying, hey, can you do it bigger with more effort? So they really don't have to memorize a set of procedures of this is how I do sit to stand, this is how I get in and out of the tub, etc. We choose functional, meaningful, and familiar activities so that the patient is engaged. I think of an example recently that the therapist brought up where the patient spent their whole life enjoying ballroom dancing and over the years had to give that up related to changes from Parkinson's disease. But she integrated some of these dancing concepts and moves into therapy, and actually the patient was able to restore to some degree his ability to dance. And so it was very meaningful for that patient and very motivating for that patient as well. And lastly, realized treatment may need to be extended past 4 weeks or past 16 visits, and that is okay as well. So caregivers play a very, very important role in people with advanced Parkinson's disease, and we do our best to educate and support caregivers as well. One of the first things is that they really need to be aware of the sensory deficit that the person with Parkinson's might feel too big or too loud, even though when they're, sounding good to you or looking good to you, they might need some positive reinforcement that, hey, that sounded great. You actually didn't sound too loud at all. I could finally hear you. That's very, very motivating for people receiving LSVT. Caregivers can help with a home exercise practice and in some instances need to learn how to coach and do the exercises with them. Sometimes as simple as popping in a DVD or playing a video so they can follow along with the exercises. Sometimes it's setting up the environment for safe home practice, or even just standing by and supervising for safety or reminding them to do their exercises. Caregivers can help to remind about carryover assignments, how to cue properly for a louder voice and bigger movements, but cue in a way that's not hurtful. So we would never want to, cue so big that the person is shouting or moving in a way that's excessively big. Caregivers are often trained how to help if there are freezing of gait issues. They're also provided education on fall prevention and safety at home and how to best help with mobility and activities of living so that the person with PD is empowered to really do as much of that activity as they can on their own. So there are some tools that we provide access to on the LSVT global website. You can purchase or download videos. I think these are also available on Amazon. These are called homework helper videos. There's an LSVT Loud one that really goes through all of the LSVT Loud speech exercises. And like I said, that can be downloaded or it can be purchased as a DVD as well. The LSVT Big Homework Helper Volume 1 is for the standard exercises and also shows, the model shows how to hang on to a chair on one side and do the exercises for people with mild balance difficulties. And the Homework Helper Volume 2 is probably most applicable to people with advanced Parkinson's disease. It shows the exercises done in a seated position and in a supine position. And what I love about this video is Chapter 3 is a special video just for caregivers. It walks through, how to help a person, how to cue, some do's and don'ts. So it's very helpful in situations where not all of the caregivers involved with the patient can make it into therapy, but it's a useful thing just to watch because it tells you what the therapist might tell you if you were to observe a therapy session. One of the tools that's very specific to LSVT Loud is called the LSVT Companion, and there's a client edition, and this is a software program that can be installed if you've gone through LSVT Loud or are going through LSVT Loud that will basically walk you through all of the treatment exercises. It'll also include reading activities that the therapist can personalize for you. And you can see on the screen here if you're in that green target zone of healthy vocal loudness. So it's a wonderful system to enhance and promote really good quality practice of the LSVT Loud exercises at home. And it's pretty easy to install on a PC. So if you're a therapist in the audience, you might wonder, how do I decide if LSVT Loud or LSVT Big are the right fit? Because in all honesty, maybe there's patients sometimes or situations where it's not a good fit. And we do go through this in a little bit more depth in our certification course. But these are the basic questions we ask ourselves. Is there a muscle activation deficit? So, are they able to move bigger, but they just, aren't activating it? Is there a problem with sensory processing? So they're not aware that their voice is so soft or that their movement is smaller than normal? Is a patient medically stable and safe and ready to start an intensive exercise program? So if someone were recovering from a hip surgery or knee surgery or, pneumonia or something like that, we would wait till they're really medically stable and able to fully participate. Is there a support system in place who can be trained to assist with exercise program at home long-term and learn how to cue? That can be really important for people with advanced Parkinson's disease. And does the patient respond to stimulability testing? So on the next slide, we'll talk a little bit about what stimulability testing is. It's kind of a different term that you might not have heard of before, but really we're looking to answer the question, can the patient increase the amplitude of their voice or movement if the therapist drives their effort and shows them how to talk louder or move bigger? And if the answer is yes, that they can talk louder, they can move bigger when I stimulate them to do so, that's a really good prognostic indicator. We also audio and video record of what their typical movement and voice are like and compare it with a bigger or louder movement and voice. And then we ask ourselves, does this cued big movement or cued loud voice have an impact on improving function? So can they get loud enough that they can be heard in conversation? Can they move big enough that they can actually get out of a chair with less assistance? And then beyond that, we always recommend doing a week trial of treatment of LSVT Loud or LSVT Big per protocol. And at the end of the week, you'll have a really good sense of if this is a treatment intervention that is working to help the person. So some closing thoughts before we get to questions. As you know, advanced Parkinson's disease is complex, it's challenging, but we also want you to know that it's never too late to make improvements in communication, function, and quality of life. The treatment exercises and activities can be adapted as necessary to ensure success and safety, but still be challenging at the same time. We know that lesser treatment, like fewer visits, taking it kind of easy on our patients, a lesser dosage, is not really the answer that's helpful for people with Parkinson's disease. If anything, they need more repetition of practice and more frequent therapy episodes of care. The focus of goals and treatment should really be on function and training those around the patient how to best assist, support, and cue them for optimal independence and quality of life. And the LSVT programs do provide a lifelong model of care to support people with PD and optimize their function regardless of disease severity. So with that, I'm going to turn it back to Beth.
All right, thanks so much, Laura. That was a really nice comprehensive overview of LSVT Loud and LSVT Big and how it can be applied to all stages of Parkinson's disease. So thank you. So we'll wrap up here with some opportunities to learn more. So we encourage you to check out our website, so lsvtglobal.com, and then also our blog, so blog.lsvtglobal.com. Just like we're doing a webinar here today, we do these every month and we have them all recorded. So they're available on demand and there's a variety of topics available to you that you can find on our blog. Also an upcoming schedule for the live webinars. We'll get our 2022 schedule up there soon as well. And we have some blog posts, testimonials, videos, all the research, all the citations and some of the articles are available on the website. And then the main website has some nice resources for both patients and family. There's a section dedicated to that. The Find a Clinician tool, which I'll talk about on the next slide. And then we also invite you to follow us on social media. We post updates and events and opportunities there. So on Facebook, Instagram, Twitter, and LinkedIn, and you can search for LSVT Global. And if you're considering getting started with LSVT Big or LSVT Loud, you can ask your doctor for a referral and a prescription for physical and or occupational therapy, which would be LSVT Big, or the speech therapy approach, LSVT Loud. And then you'd want to ask for both evaluation and treatment. So as Laura mentioned, the treatment is 16 sessions and the evaluation would be done prior to that. So it would be an additional session. You can also search for LSVT Loud or LSVT Big certified clinicians on our website. And so the picture on your slide here shows you a screenshot of the home page of our website. And if you click on Find LSVT Clinicians, then you can find clinicians. You can type in your location, and if you're looking for LSVT Loud or LSVT Big, and it will pull up a list of clinicians in your area, and you can also contact them directly to figure out how to get started, ask questions such as if they take your insurance, make sure that they're delivering the full protocol. Once you find that list, we have a list of questions that you can ask them. So that's how you can get started. If you're interested in getting LSVT certified, if you're a clinician joining us here today, we have both online training and then, well, we used to do in person. Right now it's on hold, but we do something called virtual live, where some of the sessions are held online and then some are in person virtually. So we're doing that right now, and you can click on Get LSVT Certified to see dates for those courses. We do have a few minutes for questions, so we'd like to take those. And Laura and I can also stay on for a few minutes after if additional questions come in. You can type in your question in the chat box, or I'm sorry, the question box on your webinar control panel, or you can raise your hand if you have a question, and then I'll just call out your first and last name to unmute your microphone. And you can always email your question also at info@lsvtglobal.com. I'm just going to show the last two slides first, and then I'll come back to this question slide and we'll get to your questions. We encourage you to join us next month. So we have another webinar all about the research. So the research and clinical updates from this past year. So that will be on December 15th from 2 to 3 p.m. Eastern Standard Time in the US. So you can register online at our blog at the events tab. And then we just say thank you for joining us. We know we're at the top of the hour, so again, we'll stay and answer those questions. But if you do need to leave, you can certainly leave. You'll be in attendance for the full hour, so you can get a certificate if you like it. And when you exit, a survey will pop up, and we do encourage you to take that survey. It really helps us improve our webinars make sure that they're tailored to your specific interests and that they're beneficial to you. So I'm going to go back to the questions. So let me pull up, we had a question come through, and feel free to type these in as we're going through them. So this is related to LSVT loud, so I'll take this one. So this person says that the problem they are having of speech is not with the loudness, but rather the rapid way I began talking since I discovered that I have Parkinson's. So what would you do for me? So that's a great question. And I think Laura touched on this briefly, that even though the training target for both approaches is one single target, with LSVT loud, we're focusing on loudness, we're seeing a spread of effects into other areas as well. So even though as the patient, you would be focused on a louder voice, the therapist is going to be looking for other areas to improve as well, such as a rapid pace. Some patients may have more difficulty with articulation or intonation. And through that loudness, we're working on healthy vocal quality, healthy vocal loudness. We're also improving these other characteristics through the therapist model. So again, even though your question would be more a concern of you want to improve your rate, the therapist is going to model and shape your voice to improve your rate, while also improving the loudness and the vocal quality. So it would still be, LSVT Loud could still be a great program for you, and you can certainly talk to your therapist about the rapid speech is more your concern, but the therapist would still have you only focus on loudness, but would still be shaping your voice to improve the pace, the rapidness of your speech as well, through different techniques that he or she has learned through her clinical training and through the workshop that we provide clinicians, because we're seeing this really nice spread of effects into the entire speech production system, to include not only loudness and quality, but also improvements in rate, articulation, breath support, lots of different areas related to overall communication. All right, and it looks like there's just one other question. So Laura, if you want to take this one. So is LSVT Loud and LSVT Big reimbursable by Medicare?
Yes, great question. I'm sure that's on the top of everyone's minds, is it going to get paid for? The great thing about Medicare is that there is not a visit limit with regular Medicare Part B. There is an annual therapy threshold that's combined for speech and physical therapy, and a separate one for occupational therapy. But as long as the therapist does an adequate job of documenting the need and why skilled therapy is needed, they can go on beyond that threshold, just applying a modifier code to their billing. So yes, that is the answer.
Great. And I just saw a hand raised. So I see Michael Costello, I see your hand raised. So I'm going to unmute your microphone and you can ask your question out loud. So it looks like you might have to unmute yourself, because I think you muted yourself. So if you can unmute it, there you go. Okay.
Oh, thank you. I was trying to get used to this. My question is, I was referred to LSVT and LSVT loud by my speech therapist, speech therapist. So that's how come I'm on this webinar.
Okay.
My question is, what do I do next?
Yes. So what do you do next? And that's a great question. So after LSVT Loud, so you'd want to make sure that you had the full protocol, so that it was just as Laura mentioned in the webinar, the 4 days a week for 4 weeks, 1 hour each session, individual sessions, to make sure that you're getting the same type of therapy that was done in the research studies. And after that, your therapist should be following up with you. So every 2 or 3 months. Sometimes it's just a phone call to check in and see how things are going. Other times it's having you come back into the clinic to do what we call tune-up sessions. So that might be a few sessions of the treatment to get your voice back up to the loudness where it was when you were discharged from treatment. It might be working on calibration to make sure that you still feel that same effort that you did when you were doing treatment previously to get you back into knowing the amount of effort that it takes. But just as Laura mentioned, we do want it to be like that dental model. So you should be practicing your exercises every single day for about 15 to 20 minutes. And then your therapist should be checking in with you every 2 to 3 months. So if they haven't checked in with you, you can certainly check in with them and say, you know, I'd like to come in for a follow-up visit, you know, a new evaluation to see how I'm doing. If that therapist is not available anymore, then you can that slide that I showed about how to find a certified clinician, you can find another clinician in your area. You could also ask your neurologist or primary care physician for another evaluation for speech treatment so that you continue to be followed. But we want to be a part of this journey with you, and so you want your therapist to be following you. So you do want to be checking in every 2 or 3 months to see if you need further sessions. Laura also mentioned a program called Loud for Life or Big for Life. And so you can also search on our website that same find an LSVT clinician. If you search in your area, they'll have like a designation in their profile that will show if they are Loud for Life or Big for Life trained. And that would be a group of people who have gone through the LSVT Loud protocol already that continue to meet usually weekly and continue to work on the same exercises that they did in the full treatment protocol, but rather it's in a group format, so it's fun, it's engaging, it's motivating. So that would be another option as well to see if there's one in your area. So we would encourage you to look into that also.
What's happened is I had a session with him during the week. He sent me this link and
Okay.
some dates. It was I think it was for a week.
Okay, great.
And I got an appointment with him in March.
Oh, great. Okay, so you haven't gone through the therapy yet.
No, I don't know how to.
Great. Okay, so it sounds like you are going to start though at next year in the spring.
Well, it is no. I think it was 4 sessions a week.
Great. Okay.
And is it so? Would the next stage be the course?
Yeah. So it sounds like if you're on the schedule for 4 days a week, that's how it should be. So that you should see that therapist for 4 days a week for 4 weeks. And every session should be 1 hour, and it should be one-on-one therapy with that therapist. So it sounds like you have a good plan of care getting started for you.
All right. So when I log on, I'll speak to a therapist. Is that right?
Yep. Speak to your therapist. Yeah, just to make sure that you're on the right schedule. But it sounds like if he's doing 4 days a week, then you're on the right track. Just make sure that it's 4 days a week for 4 weeks in a row. Yeah.
Okay.
All right. Great. Thank you, Michael.
Thank you. Thank you.
And we have one more hand raised. So I have Regina Maria Armada. I've unmuted your microphone.
Yes. My problem is that the speech is not is not loud, but the speed of my speech began a little bit much more rapid. I discovered that I have the Parkinson. So I don't know what to do about this because I've even when I talk to telephone, it's difficult for me to make me feel easy to talk with, that don't they doesn't see my gesture of my mouth.
Mm-hmm.
So it's difficult for me to do this. So I don't know what you can do for me in terms of this. And I'm calling from Brazil, so I don't know if you have any LSVT here, therapists here in Brazil.
Yeah, so it's a great question. So again, even if your concern is mainly not loudness, your
Yeah.
therapist through loudness can work on improvements in things like your rate of speech. And I would have to just double check if we have therapists in Brazil, unless Laura, you know that, but I can search real quick. The other option would be.
Yes,
Oh,
I'm
go ahead,
almost
Laura.
positive that we do. Yeah, I'm almost positive that we do, but we would have to do a little searching to see if there's one close to you or someone in your area that could deliver it via telehealth called eLoud.
Okay.
Yeah, and Regina, if you can email the info, it's info at lsvtglobal.com. It's the one that's on the screen here. And just ask to receive help finding a clinician. We can do some digging for you and send you a list of clinicians in your area who might be certified.
Okay, thank you very much. Thank you very much. Okay,
Yeah.
thank you.
Thank you. Thanks, Regina. Thanks, Laura.
Mm-hmm.
And Laura, there's one more question that came through that I think would
Okay.
be good for you. So this person wants to ask about offering a course to a group of OTD students. She wants information about this. She's not certified, but would like to be certified. And since she has some OT students who are interested in getting certified prior to their capstone experience, which is a 14-week component in the final semester.
Yes, excellent. So I can follow up with you via email and send you some detailed information about that. Just to give you a brief answer, it's very possible. It's very simple and straightforward to do. We use our online LSVT BIG training and certification course, and we just launched actually a brand new version of that this fall. You can learn right along with them if you want to, or they can learn on their own without you being involved with their learning too. So they also get a great discount as students, and then they can utilize LSVT BIG on their last clinical experience if they have an LSVT BIG certified OT at the facility where they'll be at. Or certainly they can use it as soon as they graduate as well, either one. But I'll follow up with you, Penny, via email. I should have your email address here, and it'll be coming directly from me. I'll try to do that this afternoon.
All right, great. Thank you, Laura. So I think that's all the questions we have. So thanks for, again, spending some time with us today. We hope that you can join us on another webinar. And again, feel free to reach out if you think of anything else after the webinar here today. So thank you to Laura, and thanks for all our wonderful participants today. Take care.
Thank you, everyone.